Let's go ahead and get started. So welcome. Thank you all for being here. And I'm excited to start this first session of our Postbac Career Exploration series for this fall. And today we're going to be talking about careers in clinical psychology. So we have a really great panel for you all. I want to just address one kind of logistical issue, which is that as you enter your questions, please use the Q&A box. I'm going to be monitoring that more so than the chat. And so if you put your questions in the Q&A, that would be really helpful as we go through. And so I want to thank our panelists for being here. We have folks from different aspects of clinical psychology to talk to you about what they do. And so we have Dr. Jashawn Mance, who is an assistant professor and co-chair of graduate admissions at the psychology at Howard University. Also, Dr. Laura Quacko, a health science administrator and a credentialed clinician psychologist in the Division of Treatment and Recovery in IAAA, National Institute on Alcohol Abuse and Alcoholism. Dr. Andres de los Reyes, professor of psychology and also director of the Comprehensive Assessment and Intervention Program in the Department of Psychology at University of Maryland, College Park. And Dr. Audrey Thurm, who is the director of Neurodevelopmental and Behavioral Phenotyping Service in the Office of the Clinical Director at the National Institute of Mental Health. So thank you all very much for being here and sharing your expertise today with the trainees. I'm going to ask each of you to spend a couple of minutes just briefly to tell us about your career path and your current role. And so, Dr. Mance, let's start with you.
Sure. Good afternoon, everyone. My name is Jashawn Mance. I am a licensed clinical psychologist, specifically a child psychologist. A little bit about my path to this role that I'm currently in. I'm also director of clinical training in our clinical psychology program at Howard, as well as the chair of graduate admissions. But prior to getting to Howard, my long and twisty role, if you will, to getting there is I'm one of the few people, I guess you could say, at a very young age, I knew I wanted to get a degree in psychology. So at the age of 12, and you might be like, what? At 12 years old? So I'm getting ready to date myself. So for you young people, back in the day, they used to be encyclopedias. And there would be a person that would come door to door and sell encyclopedias. So my mother always made sure that we had up-to-date encyclopedias. And so even if we didn't have homework, I would have to pick a subject and do a book report. My mom was an educator, she was a teacher. So I have to say that. I come from a long line of educators. My grandmother was a teacher. My grandfather was one of the first black principals in our small town. And, so a line of educators. So I got to P, the letter P, so psychology. And at that time in there was this different kind of subdisciplines in psychology, and abnormal psychology was one of them. And so I became intrigued. My mom told me at a very young age, you're going to be a doctor. So she was like, you're going to be a pediatrician. And I'm like, I don't like doctors. Like, no. But long story short, kind of fast forward, within my I grew up in a really small town in South Carolina called Darlington. It's a rural area. So the idea of kind of thinking about mental health was just something that just wasn't done. And it particularly wasn't done in the Black community. So it was more of like you go to church and you pray that issue away. Therapist, psychologists, it's just not what we do. But being in a small town, you see visions of the big city. And so what we mean by that is that there was a lot of violence kind of beginning to happen in this really small town. So when I was in high school, there was violence that happened right outside of the high school, and it resulted in the loss of one of the students. And I realized that there wasn't a lot of mental health response there. And so from that point on, I really wanted to focus on mental health. And so I really became intrigued with psychology. And so that started the trajectory from undergraduate degree in psychology. Then I went and got a master's in community psychology from Florida A&M University. And then my PhD at DePaul University in Chicago. I did my APA internship at Duke University Medical Center, and then my postdoc at Johns Hopkins School of Public Health. And the reason why I think it's really important to kind of talk about community psychology and then the clinical psychology degree in public health is because a lot of my research now is in community-based research. My postdoc was in community-based participatory research. So a lot of my work, when I was in grad school, I was in PhD as a research degree. And so I was interested in research, but I was more so interested in the clinical piece because I really wanted to give back. So I was driven by wanting to serve populations that had a lot of stigma around mental health. And so I became interested in research because I realized research can look a lot of different ways. You know, it doesn't have to be the rat in the lab. It doesn't have to be, it could be, research can look a lot of different ways. And so I became intrigued with community psychology, but also I still wanted that clinical aspect. So a lot of my work kind of centers around clinical community psychology. And so that kind of led me to that postdoc at Johns Hopkins in the School of Public Health. And then I just kind of moved on, staying in academia, but a lot of my research being in community-based research that focuses on child traumatic stress, so coping mechanisms and understanding symptoms and coping as it relates from the cultural context. So that a lot of my research has been kind of focused on that. So I ultimately ended up at Howard University, and I'm there by choice because it is a HBCU, a historically Black college or university. And there's only 2 PhD programs at HBCU. One is at Jackson State and the other one is Howard. Howard is the very first one. And Howard is very historical because they were instrumental in the Brown versus Board of Education adult studies were based at Howard. So it's a lot of history there. And the mission of Howard is really kind of focusing on addressing health disparities in mental health and making sure that we are producing scholars that will continue to contribute to that line of work. And so it was more so of I'm there by passion, and that's my long and winding road.
Yeah, thank you so much for sharing all of that, and especially kind of the personal aspect of it. Dr. Quacko, let's have you go next.
Sure. I'm Laura Quacko. I am a health scientist administrator, program officer, and also a credentialed clinician at NIAAA, the National Institute on Alcohol Abuse and Alcoholism. I have a similarly winding road, although the details are a little bit different. But I, back in the day, didn't really want to go into psychology, but was very interested in going into education. And so I had an interdisciplinary undergraduate major in education and cognitive science, and then worked for several years doing educational research and really enjoyed it, but ultimately wanted something that was more applied and more focused on working directly with people than I thought I could be doing educational research. And so I ended up at the clinical psychology program at Catholic University, which is one of the longest running continually APA accredited programs in the country, and offers a really rich clinical setting for training being in Washington, DC, as well as all the research advantages of being here as well. And really grappled with the tension of pursuing clinical work versus research all throughout graduate school and even after. I conducted my clinical internship at the Counseling Center at American University, and then promptly went off and did a postdoctoral clinical rotation at an inpatient forensic psychiatric hospital. So real shift, but something that really got me a lot of great clinical expertise. And then I came to NIH as a postdoc and was working on small clinical trials evaluating new medications to treat alcohol addiction and comorbid post-traumatic stress disorder. So it was really kind of a crash course in clinical neuroscience, but a great adjunct to my training in clinical psychology. And then I moved into a full-time research position within the intramural program there, really looking at evaluating neuroscience-based assessments to study the heterogeneity of alcohol addiction. And I really enjoyed that work, but was kind of yearning for something a little bigger picture. So about 2.5 years ago, I moved into the extramural program at NIAAA, which means that I work on the grant funding side. So I am what's known as a program officer. I spend most of my time working with potential and current grantees of NIH. I talk to them about their research ideas. I help kind of shepherd them through the application process. And then ultimately, I will advocate for their grants to be funded if they're reviewed well, and we think it's something that would fit within our portfolio. My specific research portfolio focuses on what's known as health services, which is really kind of where the rubber meets the road in terms of how evidence-based interventions are delivered through our gloriously complicated health system. And so it ends up being a really unique and hopefully helpful place to apply my clinical training and having worked in different clinical settings, but also really, to focus on the issues around alcohol addiction and services. And I'm also a credentialed clinician at the NIH Clinical Center. I do a weekly therapy group at our inpatient treatment program there. And have a lot of fun doing it. And last but not least, I'm a mom of 3 kids, which I feel like is important to mention whenever we're talking about careers. So happy to answer questions about work-life balance too, and happy to be here.
Yeah, thank you so much. It's really nice to hear that you can balance those, not just your work and life, but also really the clinical and kind of the other side of research on the extramural side. Thank you. Dr. De Los Reyes.
Hi, everyone. I'm Andy De Los Reyes. Long and winding path, I guess, is the order of the day, right? Dr. Mance, I had a world book. So you're not the only one on the panel who had an encyclopedia. My path, my aunt tells me that I said I wanted to be a lawyer when I was 4. That's the first time she heard me say something. And all throughout my development, I thought this is the path I was going. I was going to be a lawyer. I was pre-law all the way up through my junior year in college. And then I took an internship. I grew up in South Florida, so I did an internship in the judicial circuit over there, and I was helping folks file for restraining orders. Part of the internship involved shadowing a prosecutor in the circuit. And it didn't take long for me to realize that I probably wasn't going to enjoy that life very much. Their caseloads are really big. They don't get a lot of time to dedicate to any one case. And then I started thinking, well, what do I do now? Because this is a real disruptive period of my development. Turns out that where my mind went following the internship, I started thinking to myself, well, the folks I helped all this summer, they must be going through a lot of stress, petitioning the government for legal protection. I wish there was something I wish I knew what to say to them to make them feel better. Given that's where my mind went, I thought to myself, well, maybe psychology could be one way of pursuing a path. Now, and then here's the interesting thing about the law. What I thought I would like about the law was that I'd get to spend a lot of time arguing all day in front of people about stuff that I found important and winning them over. Fast forward, what I've learned, the little I've learned about law is that you don't spend a lot of time on arguing because you don't spend much time in the courtroom. I started interning in a laboratory at the university where I did my undergrad, Florida International University, with Dr. Wendy Silverman, who's world-renowned in assessing and treating anxiety disorders in children. She's now at the Yale Child Study Center, but was at FIU for many years. I originally thought, well, it looks like of the subdisciplines in psychology, the one that I'm gravitating more towards is clinical psychology. And I thought to myself, well, let me go the PhD route. I'll practice therapy like I thought I would practice law. But then I got a sense from what Wendy did all day, and Wendy gets paid to think. And that sounded awesome. And so I really gravitated towards the science very quickly. Now fast forward all these years later, went to grad school, and now I'm a professor at the University of Maryland. And here's the funny thing about science is that I didn't think I was going to get to do much. It turns out I probably wasn't going to be able to get to do much arguing in the courtroom as a lawyer, but I do a heck of a lot of arguing as a scientist. Most of my papers, hey, this is why the journal should give me space to publish what I think, right? Hey, agency, this is why you should give me money to do the thing that I want to do. I don't win a lot of all those arguments. I lose a ton of them. Yeah, that's the thing. That's the tough part of being a scientist. You lose a lot of arguments. I haven't won an argument. For instance, I haven't won an argument yet. A petition to the NIH for why they should give me money for my work. So, if anything, I've won the arguments over at the National Science Foundation and the Institute for Education Sciences. Anyway, so fast forward to now. Science, being a scientist is great. Not only do I get to argue a ton, I wear a lot of hats. And then lawyers do all kinds of stuff. They practice law. They become politicians. They become consultants and real estate agents. All kinds. And psychologists are the same way. Only as a faculty member, I can put on a teaching hat, a research hat. I can put on an editor hat, a consulting hat. I can do all kinds of stuff. And that's what I really enjoy about the job, is that you there's so much variety, and at least from my own personal experience, that no one day feels like the day before.
Oh, thank you. And thanks for that really nice reminder that you can always change directions and get your feet wet and try something out and see if it's the right thing for you. I appreciate that. Dr. Thurn.
Sure. I want to start by saying hi to everybody, and a special hello to Dr. Mance, because I'm now meeting for the first time a fellow alumni of DePaul, and that I'm really excited for that, and especially because a lot of what I was going to try to do is shout out about community psychology, which is an under sort of focused area of either clinical or separately, but we can get to that later. But I'm so glad you're here to promote that as well. My story is that I always wanted to work with children with disabilities and more severe disabilities, starting from my days as a counselor, which is actually how you get, the real good experience of being hands-on and spending a lot of time with kids, is through schools and camps and things like that. I was pre-med, so now we've covered every area. And I did think psychiatry would be a way to go for this. But I wanted to be someone who spent the time with the kids, more time, and got to know them and their families, and be able to especially focus on diagnosis and how complicated that could be. And so I did learn that the road for psychiatry, especially child, is quite a long one, where you have to do adult first, and it would be a long time before I would be seeing kids and being able to spend a lot of time with them, if ever. So I chose child clinical specifically because at certain programs like DePaul, you get in your first year, you get practicum, you get clients the first year, and you're starting to do it. And that's something about clinical psych, is that it is very hands-on, that you're actively engaged in the research from the beginning, the clinical work from the beginning, and then of course, just the learning in general, and teaching. So I really did like clinical psychology for allowing me to be hands-on from the get-go. And then from there, I was bitten by the research bug, which is something that is really core in clinical psychology, and the framework and the rubric for how we learn what we do, of what's evidence-based for assessment and clinical work and treatment. So I've stayed in the research world throughout my time, although in a very clinically focused way, except for my small stint as a program officer, which you've heard about, involved in funding autism research, which is an area that's growing a lot. I then was able to move to intramural also at NIH, where I have a very clinically focused job, where I'm able to work on a variety of different protocols, assessing children, and working with their families, and following children, all in research studies, but able to provide very clinically focused assessments and evaluations for children, and contribute to a variety of different research that's all multidisciplinary multidisciplinary, which is something that also clinical psychologists are very able to be sort of very involved with research that covers a lot of different areas and kind of in a lot of ways often being the glue or for a lot of multidisciplinary studies. So I've been able to do that and focus on neurodevelopmental disorders as my research area and continue to learn. So I'll stop there.
Oh, thank you all so much for sharing that. It's really interesting to see the different career paths. So I want to open it up to questions from our attendees, and I'll just remind you to please use the Q&A box. I'm going to start off though with one question. As you each talked about your paths, I wondered about the skills that you gained along the way. And could you just speak just a little bit about, what are the skills that are really important as a clinical psychologist, and how have you gained those? How would you recommend for our current trainees to work on gaining those?
I think that's a great question. And as I'm processing the question, I'm thinking, I'm like, okay, which hat do I answer the question from? Because I'm also in private practice. So as a clinician, and even within the doctoral program, I teach clinical assessment. So I'm like, do I answer from the clinician hat? Do I answer from the researcher hat? Or do I answer from, I really think part of being a clinical psychologist is that you can wear so many hats that you have to have an entrepreneurial spirit to a certain extent. So I'm like, do I answer from, from that hat? But I would definitely say skill set, I would definitely say being self-aware and doing the work to be self-aware. So if you are kind of sitting as a clinician, being aware to know enough to know what you don't know, right? Because you want to be of service and you don't want to do harm. So kind of having that sense of awareness, being able to have great listening skills, right? As a clinician is really important. And then I think as a researcher, when I put that researcher hat on, I'm really thinking the researcher slash professor, I'm thinking of making sure that I'm very organized and I'm very clear in my writing in the way that I'm thinking about the execution of my work, and also how I am teaching my students so they can be very clear for them. So kind of having the sense of like being organized, but then also being very clear on what my questions are, what am I exploring, so that I can add to this body of literature and I can add to the larger picture. I'll start there at least.
The ones that I'm really gravitating towards as I process this are interrelated. Like I mentioned before, as especially in research, you spend a lot of time arguing in this business, but that doesn't mean that your arguments are designed to just win people over blindly. In fact, most of that argument brings back feedback that allows you to sharpen your arguments, get better at the job. So if I were to say that the crucial skills, from my standpoint, that cut across many different areas of work in clinical psychology, not just research, is to be willing to accept feedback, be willing to be able to learn how to respond to feedback, and be resilient, sort of build resilience to receiving particularly harsh feedback, which is unavoidable in this business. You will get into circumstances where you're going to hear responses that you might not be prepared to hear. Like this piece of work isn't good enough to get to the next stage. This application isn't good enough to get admitted to this program, and those things, being able to recover from and learn from those setbacks. Those things you're not born with those. They're instilled through practice, and through getting into. And the good news is that in this business you're exposed to those circumstances so often that putting yourself forward goes a long way with being able to get practice on how to do it and keep on getting better at it.
So I can answer a little bit just relating to just sort of clinical work and research informing clinical work, which is that clinical psychology is very much based in research methods, in psychometrics, in measurement, and just in being empirically based. And so the skill that I want to talk about is just continuing to learn and research throughout your career. You know, when I look back at what I learned in grad school, the tools are all different. A lot of the thinking is different. A lot of the methods are different. But the way we're taught to, to review articles, literature, and even clinical methods continues, right? Is to be very driven by looking at data and using what's empirically based, because all the methods for everything will continue to change, but our way of thinking and analyzing to inform our clinical work will continue to evolve. And that's what we learn, is that we're going to have to continue to evolve.
Yeah, I echo everything that everyone has said. I mean, it's a great question, and these are really thoughtful answers. I think being flexible is one of the most important things, and I think everyone has kind of touched on that, but flexible in all ways in terms of what you're asked to do, what you're asked to learn, thinking across different aspects of psychology and clinical psychology is important. I also think it's really important to be curious rather than judgmental. Be curious about people in particular, whether that's as a clinician, as a researcher, whether that's even just, in my role working with grants, being curious about specific research questions and how we might improve on them is really important. But I think that's one of the core aspects of being a clinical psychologist, is sort of being endlessly curious about the field and about how you can apply different aspects of it to help people.
Yeah, thank you all. We have a couple of questions from people who are considering changing directions, and several of you shared that you changed directions. So what advice would you have for someone who either majored in something that wasn't related to clinical psychology, or is currently doing kind of preclinical or translational research that may not be directly related? And in terms of when they think about an application or taking their next step, how would they demonstrate that? What kinds of experiences should they try to gain?
I can start. I think because when I worked in the intramural program, I advised a lot of post-baccalaureate research fellows, who were applying to clinical psychology, and many of whom did not have clinical experience yet. So I think really getting your hands wet in the clinical world as much as you can. So volunteering is a great opportunity, whether it's at a community mental health center. There are many crisis hotlines, whether that's call or text-based, that often offer really outstanding training and support. And that's a great way to kind of, dip your toes a little bit into the clinical world. And especially working with people who have mental illness. I think it's important to show that you're willing to do that. But there are lots of other avenues, whether it's working at maybe camps that are focused on working with kids who have developmental disabilities, or Big Brother, Big Sister program, but something working with people, I think, is really important for those who don't have that experience. And if it's more sort of a content shift, like, for example, I was in I had an undergraduate major that was not psychology. It can be helpful to demonstrate content knowledge in psychology. That could be a psychology GRE, or, if there's coursework that you can take in psychology to show that you have basic foundational knowledge. There was something I was going to say, and now I lost it. But I think, it could also be, depending on the lab that you work in, if you have the chance to switch to a lab that is more clinically focused, at NIH or somewhere else, that can be another really great way to get that experience. So you're doing the work of a clinical research assistant, rather than working in a wet lab or working with animals or things like that.
Yeah, and if you can't make, a shift, because that is sometimes hard, even just shadowing, shadowing different kinds, which is probably helpful for everybody anyway, because you might think you're interested in one type of clinical work, and then you get exposed to another. I think a lot of people at NIH are willing to do that, and I think at a lot of different places. It is sometimes hard to actually get the experience right hands-on with people in the mental health field until you're in it, but just being able to observe, shadow, and even interview people who do the work, I think are all really important steps to help figure out, which direction you want to be able to go in.
These are all really useful and practical points. The one thing I might add here is I wouldn't necessarily sell your background in other disciplines short. And by that, I mean, psychology being a bridge discipline, it connects to so many different areas. And so I've had colleagues of mine and mentors who were philosophy majors in college, biology majors, family science or human development, education. I mean, all these different disciplines, even though they don't have psychology in the title, give you immense exposure to areas and research areas, and theories that connect quite quickly to psychology and what we do. One thing I would encourage you to think of is go back to your reading, sort of ask yourself, what aspects of this do feel familiar compared to the kinds of things I'm consuming in psychology.
Yeah, I agree with everything that's been shared, and I definitely want to just kind of piggyback on Dr. Loray's comments in regards to don't underestimate the skill sets that you've learned in other disciplines and how they can translate to psychology. And even if you're working in a lab that's not related to psychology, you're still learning research skills, right? So you're still learning how to form hypotheses, how to ask questions, how to conduct analyses. Like, you're still learning the skill set of related to research that you can then translate or use into clinical research. And I definitely agree with kind of getting experience from the clinical, more applied perspective, just working with people, right? Show that you're able to work with people, you're able to connect in your own way, right? But just definitely don't underestimate the skill set. Think about the skills that you're learning and how they will work for you in regards to graduate studies, and then transitioning into your career, the skill sets that you will learn.
Yeah, thank you all. We have quite a few questions about the application process. And so I wonder if you could speak a little bit to the process of applying for a graduate degree in clinical psychology, and specifically a couple of questions about the personal statement. What kind of skills and experience is it best to highlight, and how much do they need to say about their future career goals? Are there right and wrong answers, that sort of thing?
I can get the ball rolling here. I mean, this is it's such a great important question, because the one thing you'll quickly learn with seeking out a clinical degree is that the process is fundamentally different from all the other processes you've encountered before applying to institutions of higher learning. The biggest one for me is that you stop really applying to programs and you start really applying to people. Because at the end of the day, when you're graduating from whatever institution you're graduating from, the president of the university or the dean or the provost is not writing you a letter of recommendation. They're not the one picking up the phone for a reference call or something like that. It's the person who took you under their wing for those 5 or 6 years of your life, your mentor or mentors. And so as a first step, I always suggest to my students, make a habit of consuming work in the area. Make a weekly habit of like reading through journals and reading papers and noticing which ones have been catching your eye, because in all likelihood, the ones that have been catching your eye, a lot of the same people are doing work in those areas. And then you're scanning the author list and you're saying, oh, this so-and-so, it appears to be doing work that I really find stimulating. I really think it's curious. I wonder A, are they in a clinical program, and B, are they taking a student next year? And as you work through that process, you'll build a list of people to reach out to, and then the personal statements really connect with that sense too. Is that then you have to basically make the argument: this is the path I've followed. This is why the path has led me here, and this is why I think these people will set me up for the next stage of my career more so than any other person I can think of at this program or other programs.
And I also want to say, this is where I think if you are making a switch, when you are kind of highlighting that statement, this is where you want to kind of highlight, yeah, I've kind of taken this trajectory. I'm making this switch because, or I'm making the switch and I want to come here because this person is doing X, Y, and Z. So kind of find a connection there's a connection there. And in some capacity in regards to now I'm switching, or why you want to do this work and why this institution and specifically why this person. You don't necessarily, it's great to kind of make that connection of why you want to work with that individual, because most programs are mentorship models, but we're not expecting you to know everything. That's why it's a training program. And I think a lot of times people are like, well, I want to show that I've had all this experience. It's great. That's awesome. But we also want to train you, right? So we don't want you to kind of feel like you have to kind of pigeonhole yourself into, but you do want your interest to be aligned with the person that you are applying to work with.
So to broaden it out a bit, so clinical psych is one degree, but there are so many different areas within it. And then, so there's dimensions, right? There's the dimension of, are you interested in child, neuropsych, community, and there are many others. But then there's also the dimension of research versus clinical. And so understanding where you're going, and it's okay if you want to apply to a variety of these, as long as you have the cell for each one of them. But we've been mostly talking about the more research focused programs where it is usually, very much a one-on-one mentor fit that you're applying to. But there are programs that are more clinically focused, that are bigger, including PsyD programs. I want to always emphasize that PsyD is an absolute great pathway to becoming a clinical psychologist. It's just much more clinically focused, bigger programs, and less of that mentor one-on-one fit. And so you would just gear your application differently for those, right? For all those programs. But a lot really are this fit, where you really do, as was said, need to make sure that person is taking a student, and then make the case for the fit for that person. And sometimes within programs there are multiple people that are doing similar things, that and that's okay too, because again, you're not everyone knows you're applying to multiple people, that you're not putting all of your eggs in one basket, but just that there is a story towards where you're going, and that person, exactly as has been said, will see that you have skills that can bring to it. And sometimes those skills may be not what they're doing. If adding MRI or adding something specific that you've been doing may be exactly what helps them continue learning and growing. And other times, it can be broader, that you just want to do this area, and that they do want you to be working together with them to be figuring out what you're going to do, and that it isn't totally set, because things do change. But looking at what grants faculty have currently, what they're actually actively doing, certainly what they've published, who they're working with, and then of course trying to find out what the culture is and what the situation is there, are all to your advantage in making your application be relevant for them.
I think one additional thing to consider too is that graduate school is not going to be the last thing you do in clinical psychology, right? So you want to get in, that's the first step, and then you want to get done. But then you want to go on to something else. So when you're evaluating programs and you're writing your application, think about that. Like, is this good fit going to be something that gets me on to my next step? And you don't necessarily have to know exactly what that next step is. But for example, if you want to, you're fairly certain that you want to go into full-time clinical practice, then a program that is largely research focused may not be the best fit for you, if you have to really compromise your integrity in order to apply there. So think about what program is going to maybe maximize your options and give you the best springboard onto that next step. And you can look and see where graduates of that program have gone on to. You can certainly talk about that in the interview process, but really try to take the big picture and the sort of long perspective that graduate school is a really important part of your career, but it's also the first part of your career. So you want to identify what's going to be a good fit and then help you move on to that next step.
Yeah, that's such a good point. Along those lines of thinking about the right fit for program, we have a lot of questions about different types of programs. And Dr. Thurm, you mentioned this a little bit, but could you all kind of compare and contrast clinical psychology versus counseling psychology versus a PsyD versus maybe even experimental psych or neuroscience?
Well, I think, again, it depends really on what you want to do. A degree in clinical psychology, and I know there are a lot of now sort of subspecialties within clinical psychology that you can get a degree in. A degree broad in clinical psychology is going to afford you the most flexibility. Counseling psychology tends to be more focused less on psychopathology and more on working directly with people, and particularly in educational settings. So that's often a distinction. How that's reflected in terms of actual clinical practice and ultimately what someone does may be a little less clear. So those are PhD programs. A PsyD program, as Dr. Thurm mentioned, is more clinically focused. So there's often a research component, but it typically is not to the level that you would find in a PhD program. One of the more practical considerations that I think is really important and absolutely worth asking about is how these programs are funded, how you will be funded as a student. Will you be on someone else's grant? If so, how long will that grant last? What is the certainty there? Will you have to apply for scholarships? Will you have to do that every year? Are there TA-ships or research assistantships available? Will you have to take out a lot of student debt? You should feel comfortable and well within your rights as a potential student to ask, what's the average debt burden of someone who graduates from this program? Those are practical considerations that I think sometimes aren't necessarily discussed in the application process and then differentiating within programs. Sometimes some of the larger programs, whether they're PsyDs or even some PhD programs, may not offer the kind of financial support for graduate school. And so you can end up with a really high debt when you graduate from. And psychology has many wonderful things about it, but it's not typically the most lucrative field. There are not many options for earning, high six-figure salaries, especially right when you graduate, unless you want to work 80 hours a week, which is maybe not advisable. So that's a practical consideration that I would think about. But ultimately, it really depends on the best fit. There are fantastic PsyD programs out there that will give you, really outstanding clinical training. And, there are PhD programs in counseling psychology and clinical psychology that may be the best fit for you, depending on what you want to study.
Those are all really, really useful points. The one thing that I think is really important to draw from that advice is that you want to educate yourself on the nature of the support and connect it. Let's say you're thinking about a program that doesn't tend to provide a lot of financial support for students. I then would want some really good data on the outcomes of students from those programs. So to what degree, if I'm going to invest money in my education, which for many of these programs, you don't necessarily have to. It's one of the reasons why the class sizes are so low. That if you remit somebody's tuition, you give them a stipend, you're not going to be able to do that for a lot of people. And so regardless of these programs, whatever you're investing in, time, money, what have you, you want to look for information relevant to program-related outcomes. What kinds of jobs do folks tend to get after training, and are those the kinds of jobs that I would like? And the more you're investing, the more you'll want to know that information. And any really good program that's proud about their students is going to make that information really easy to find.
So it just, with your question, just making sure that we clarify that. So clinical and counseling and school psychology are all degrees that come with licensure or certification that allows you to have direct patient contact or student contact or client contact, depending on the situation. They also then are often required for being credentialed and getting privileges at hospitals, in terms of being sort of an independent practitioner and being, certified with privileges to be interacting with patients with, and of course this relates to reimbursement and billing and things like that. And then within those, and clinical especially now, like we said, there are specialties like neuropsychology and that have additional boards to them that specialize you, and that's really for assessment for neuropsych, where now there is some reimbursement for some things that is tied to these boards. That's becoming more and more of a thing. So then I think you were asking about clinical versus other areas of psychology like experimental, social, developmental, that do not come with it, with that clinical degree. And again, there is also a separate community. Some of these can be within clinical, like there are community clinical programs, there are child clinical programs, but then there can be separate. And so the degrees that are not clinical then would not offer the clinical aspects, the assessment, the practicum, the hands-on experience. It doesn't mean you couldn't be doing clinically relevant research with those degrees. You just wouldn't be in the role of being the licensed person within those studies, if that makes sense.
Yeah, thank you. And thanks for really clarifying all of that. One of our attendees has pointed out that PhD programs in clinical psychology are quite competitive. Can you talk a little bit about what makes a competitive applicant? What does a competitive application look like?
I think that's a great question, and I hate to kind of give that same response of like, it really depends on if it's a PhD program and more of a mentorship model, it really depends on what that professor is looking for that particular application cycle. So for example, I have potential applicants emailing me all the time and saying, hey, I've had this experience, here's my CV, are you accepting students? Like, yes, I am, but maybe for this particular year, I'm looking for someone that had a little bit more experience related to statistical analysis. Maybe I'm looking for someone that is right out of undergrad. Maybe this time around, I'm looking for someone that has a master's degree that has more graduate studies because of where my research is, right? So sometimes it kind of varies from that perspective. From a foundational standpoint, I'm not always looking for someone who was a psychology major. No, maybe not, but maybe they've kind of worked in the field for a while, doing things that are like psychology adjacent, not necessarily directly in the field, but definitely adjacent to the field. And they have strong letters. They have really strong letters, but then they've also done a really good job of kind of really painting the picture of what they want to do and why, the why of the institution and the why of kind of working in my lab. They've done a really great job. I look at scores, but I don't tend to really put a lot of weight on GRE scores. I really don't. And I feel like, honestly, it would kind of go against being at an HBC, like on so many other levels, but that's a different conversation. So I don't put a lot of weight on it. I mean, yes, I do look at it from a perspective in regards to, not necessarily sense of their readiness, but let's say you took the psychology GRE and you're not a psychology major, maybe I kind of give me a little bit of an insight in regards to your familiarity with the topic, the topic area, if you will. But I'm looking at other things. I'm looking at GPA. I am looking at, maybe you didn't necessarily undergraduate in psychology, but you went on to get a master's degree, so you're able to do graduate level studies. Like you've been able to display that. So maybe your GREs weren't not necessarily that strong for you, but you've shown that you're able to do graduate level studies. so kind of looking at other things, but also because for our program, it's a mentorship match. When I'm talking to you, I'm looking to see, will we be a good fit? Because I'm committing for the next 5 to 6 years of my life and my time. I have 2 small kids and a husband. So sometimes you never know, like when it deals with the whole family thing. And I would love to hear what Laura has to say with work-life balance, because I haven't figured that out yet. So sometimes just really trying to see, is this a good match? So essentially what the student, that potential applicant, what they're looking for, am I able to give that at this point in time when you're entering into the program, right? So there are a lot of factors that kind of go into what makes a candidate kind of stand out for me.
Did anyone else want to add anything on that one?
All of what Dr. Mance just said. It's just all personal preference. It's so different. It's so different from program to program to program. The only thing I might say that might broadly apply is that because one of the things that makes one of the after effects of these programs being so competitive is that there winds up becoming a buildup of really great applicants that stacks up from year to year, because there aren't enough spots in any given year for all the really great people who would flourish in a program in this area. And so what that usually means is that once you get to the application stage, which you want to be able to describe to prospective programs, is that you've gotten enough experience to understand what you're getting into, the parts you like, the parts you don't. You might not like it much, you might not articulate those, but the amount of time that you spend in gaining experience, particularly experience in clinically relevant circumstances like laboratories and other kinds of clinical circumstances, is that you just really want to give people the idea that I know that any one career path has its upsides and downsides, and the upsides here have outweighed the downsides to such an extent that I took all the time to apply. And that should be articulated in your CV, your personal statements, all those things. So the experience really matters. But that doesn't necessarily mean that like whoever has the most experience wins. It's quality of those experiences, and just know that in all likelihood, magic does happen. Great grades and great test scores and a great experience in undergrad will get somebody placed in one of these programs immediately afterwards. It does happen, but it's a relatively rare occurrence nowadays compared to the folks who spent a great deal of time building the experience to make it clear that they're ready for it.
Yeah, thank you. So we're coming to the end of our time. This hour always goes so fast. I want to kind of honor what Dr. Quacko said earlier about grad school not being the end of your career and thinking about what comes after that. There were quite a few questions sort of asking, how do I decide what I want to do with this degree? And some of you addressed that at the beginning, but I'm curious if you could say a little bit more about how did you choose, or how did you find the balance of, I want to do clinical work, I want to do research, what population do I want to work with? How did you make those choices?
I'll start with this one, just to say that because of the type of population that I wanted to work with, at the time, autism was a more rare diagnosis than it is now, but children with very rare conditions and genetic conditions, I wasn't going to easily find that in practice, but also I saw the importance of making sure that research was being done in this, and that there was a gap that I could fill in doing that. So I do think that some of it will depend on the population, the setting, the context, just what you end up thinking that you want to accomplish will then help guide some of these other decisions, if that makes sense. But I encourage people, again, that didn't come right away. And for me, I kept fighting, staying in research, and then it kept coming back to me for all these different reasons. So some of it you just can't know until you're a little bit further down. And I know that's not an easy answer to say, but again, for me, My practicum experience were very formative, and then my internship was very formative, and then the decision of where to go for postdoc was really important. But that all helped guide where I was going afterwards. So knowing that these different steps will be important, but again, there'll be something that anchors you. And for me, it was the population that I wanted to work with.
Yeah, I think that advice to be open to what those next steps may be and comfortable that you may not know is just critically important. I mean, I really struggled with being a clinician versus a researcher all through grad school, and then had a more clinically focused internship and sort of wanted to stay on that track, but wanted to work with a different population, which is what led me to forensic inpatient psych. And then it was honestly kind of practical. It was a really long commute and I didn't want to do that anymore. And this position at NIH opened up looking at post-traumatic stress disorder. My dissertation had been on a long-term longitudinal study of women who were sexually abused as girls. And so I had some experience working with that population and, thought, hey, this is a great chance to get back into research. And then from there, it was about being true to myself about what my strengths were and candidly what my bandwidth was at any given time. Sean, I definitely don't have the work-life balance all figured out, but I think like, for example, I would love to do more private practice now, or have a private practice now, do more clinical work. And I just don't have the bandwidth at this point, but also, when I was in the intramural research program and considering whether I wanted to stay in research, I really realized that I didn't, and I really wanted something more big picture, and that would give me the chance to, think broadly about the research that we fund and, provide guidance on that, broadly in terms of what directions do we take, but then also what individual grants might be consider funding, and had to really push for that. And I'm glad I did. I love the work that I do. But I think you have to kind of be open and maybe also be a little bit practical at the same time.
Dr. Mance, Dr. De Los Reyes, did you want to say anything about that?
I think they've given really great advice. I would definitely concur with Audrey and Laura in regards to, you don't have to have it all figured out. Like, you don't have to have it all figured out. And I think part of the interesting process, I want to go back to an earlier comment that Laura made, was just continue to ask questions and be curious. And so while you're along this process, you may have an idea of what you're interested in, and it kind of leads you to a specific program or leads you to a specific mentor. But even throughout that process, kind of remain open, and you don't have to have it figured out. Sometimes there will be opportunities that are presented to you that you never even had on your, in your purview whatsoever. And then you just kind of figure out like, oh, wow, this is something that I never even knew existed. It could be an opportunity. So that's the kind of being, the idea of kind of being open. So just take the pressure off yourself. You don't have to have it figured out. You have to have it figured out enough to know that you want to do this. But beyond that, you don't have to have it all figured out.
Yeah, this isn't like picking a soulmate. If you stay open, you're curious, you're out at sea, at some point you'll find the thing that tells you it's time to drop the anchor. Just like Dr. Thurm said, to find a place to anchor, but if you stay open, you'll find it.
Thank you all so much for sharing, so much of your personal experience in the field, and really your expertise around the application process and kind of how to think about a career in clinical psychology. I really appreciate it, and I know that the attendees do. I want to thank everybody for being here today and listening, and I hope that it was helpful. I apologize we didn't get to all of the questions, but hopefully you heard something that will definitely help you in the future.